Hello and welcome back to my channel. Today we're going to discuss metabolic syndrome, a cluster of conditions that occur together and increase your risk of heart disease, stroke, and type 2 diabetes. Metabolic syndrome affects millions of people worldwide, but with the right knowledge and management strategies, you can significantly reduce your risks and improve your health. Hi, I'm Dr. Knapp, family medicine physician here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's delve into the components, risks, and management of metabolic syndrome. Metabolic syndrome is not a single disease, but rather a group of risk factors that often occur together. These risk factors include high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Having just one of these conditions doesn't mean you have metabolic syndrome, but it does increase your risk of serious diseases. The presence of 3 or more of these risk factors typically leads to a diagnosis of metabolic syndrome. One of the primary components of metabolic syndrome is abdominal obesity, often characterized by excess fat around the waist. This type of fat is particularly dangerous because it is closely associated with insulin resistance and inflammation. Insulin resistance occurs when your body's cells don't respond well to insulin, a hormone that helps regulate blood sugar levels. As a result, your blood sugar levels rise, leading to prediabetes and eventually type 2 diabetes. High blood pressure, another key component of metabolic syndrome, forces your heart to work harder to pump blood. Over time, this can damage your heart and blood vessels, increasing the risk of heart disease and stroke. High blood pressure is often called a silent killer because it doesn't usually cause symptoms until significant damage has occurred. Abnormal cholesterol and triglyceride levels are also significant risk factors. High levels of low-density lipoprotein cholesterol, or LDL, often referred to as bad cholesterol, can lead to the buildup of plaques in your arteries, increasing the risk of atherosclerosis, heart attack, and stroke. Low levels of high-density lipoprotein, or HDL, known as good cholesterol, and high levels of triglycerides, a type of fat found in your blood, are also common in people with metabolic syndrome. Several factors increase the likelihood of developing metabolic syndrome. These include a combination of genetic and lifestyle factors. Genetics can play a role in determining your susceptibility to insulin resistance and obesity. However, lifestyle factors such as a sedentary lifestyle, poor diet, smoking, and excessive alcohol consumption are significant contributors. The good news is that metabolic syndrome can be managed and often reversed with lifestyle changes. Let's discuss some key strategies for managing this condition and reducing your risk. Diet plays a crucial role in managing metabolic syndrome. A heart-healthy diet that is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help you achieve and maintain a healthy weight, lower your blood pressure, and improve cholesterol and blood sugar levels. Reducing your intake of saturated and trans fats, added sugars, and refined carbohydrates is also important. The Mediterranean diet and the DASH, or Dietary Approaches to Stop Hypertension diet, are 2 examples of eating plans that can be beneficial for people with metabolic syndrome. Regular physical activity is another cornerstone of managing metabolic syndrome. Exercise helps improve insulin sensitivity, lower blood pressure, reduce abdominal fat, and raise HDL cholesterol levels. Aim for at least 150 minutes of moderate intensity aerobic exercise, such as brisk walking, cycling, or swimming, each week. Adding strength training exercises at least 2 days a week can also help build muscle and improve overall metabolic health. Weight loss is particularly important for those with metabolic syndrome, especially if you have excess weight around the waist. Losing even a small amount of weight, such as 5 to 10% of your body weight, can significantly improve your risk factors. Working with your doctor or a registered dietitian can help you create a personalized weight loss plan that is safe and effective. In addition to lifestyle changes, managing metabolic syndrome often involves regular monitoring and medical management of the individual risk factors. This means keeping track of your blood pressure, blood sugar, cholesterol, and triglyceride levels. Your doctor may recommend medications to help control these factors if lifestyle changes alone are not enough. Medications commonly prescribed for metabolic syndrome include antihypertensives to control high blood pressure, statins to manage cholesterol levels, and medications such as metformin to improve insulin sensitivity and lower blood sugar levels. In some cases, medications to help with weight loss may also be prescribed. It's important to take these medications as directed and to discuss any side effects or concerns with your doctor. I just want to take a moment to ask that you hit that like button if you find this information useful, subscribe to my channel for more health-related content, and leave a comment down below if you have any questions or topics you want discussed in future videos. Anyway, lifestyle changes extend beyond diet and exercise. Reducing stress through mindfulness techniques, meditation, yoga, or other relaxation practices can have a positive impact on your overall health. Stress management is particularly important because chronic stress can contribute to the development and worsening of metabolic syndrome. Additionally, quitting smoking is one of the most impactful changes you can make, as smoking exacerbates all the risk factors associated with metabolic syndrome. Support from family, friends, or support groups can also make a significant difference. Connecting with others who are dealing with similar health challenges can provide motivation, encouragement, and practical advice. Don't hesitate to reach out for support as you work towards improving your health. Regular follow-ups with your doctor is essential for effectively managing metabolic syndrome. Your doctor will monitor your progress, adjust your treatment plan as needed, and help you set realistic goals. Preventative care, including regular screenings and checkups, is crucial for catching any potential complications early and addressing them promptly. It's important to remember that managing metabolic syndrome is a lifelong commitment. While it may seem challenging at times, the benefits of improved health and reduced risk of serious diseases are well worth the effort. Small, consistent changes can lead to significant improvements over time. If you or a loved one has been diagnosed with metabolic syndrome, know that you have the power to make positive changes and improve your health. By understanding the risks and taking proactive steps to manage the condition, you can reduce your risk of serious complications and live a healthier, more fulfilling life. Thank you for watching. As always, take care of yourself and make the most of your day.